Cough is basically a natural, it's a protective impulse that our body has. So imagine our respiratory system to be like a tube. If something is stuck on the tube, you put pressure from inside, it'll come outside. So that is what a cough is. Your chest contracts and creates a negative pressure, puts the item out, whatever it be. Or it might be sputum in someone who has an infection or an allergy. So cough can either be wet or dry. So dry cough is generally seen in infections and allergies. Infections as in infections of the upper respiratory system. When the infection is there in the lower respiratory system, that is your lungs, generally sputum is produced. That is when you cough, there will be some phlegm that comes out or blood that comes out. That happens in the lower respiratory infection. So dry and wet cough, treatment is different for cough. If the cough is incessant, if the cough comes with blood, or if the patient is coughing and then suddenly becomes unresponsive, or the consciousness becomes a little low. In children, when they cough, they can also have some vomiting. Children should not be given cough syrups. Since the cough is protective in nature, if we suppress that, it's not really good for children. So children should not be taking cough syrups. Anyone who's having an infection should take a consultation before taking any medicine, because that cough might be protective for them because it's taking the sputum out. Sputum generally is a very good field for bacteria to grow in. So coughing is actually good for them to take the phlegm out. Someone who's having an irritant cough, he's having an upper respiratory irritation or allergy or infection, the cough is not really good for him, but not really producing anything from the respiratory tubes or the lungs. That cough needs a cough syrup and it will be stopped. But cough that is actually productive, which is expelling the sputum, it needs to come so that they can spit it out. Cough as a separate symptom and cough with other symptoms. That's how we are classifying it. Cough with another symptom, for example, fever or sputum, that needs to be consulted. Cough alone as a symptom, it might be allergy. So even that needs to be consulted. But unless it is really disturbing your routine or your sleep, if it's a very intermittent and mild cough, you can let it be. Just manage with home remedies.